How is diverticulitis abscess drainage performed precisely? Imagine a small pocket of infection forming in the wall of your colon due to diverticulitis. When this pocket fills with pus, it becomes an abscess that needs to be drained carefully. The most common way to do this is through a minimally invasive procedure called percutaneous catheter drainage. This technique uses imaging tools like computed tomography scans or ultrasound to guide the process, making it precise and safe. First, the patient is positioned comfortably on a procedure table. Vital signs such as heart rate, blood pressure, and oxygen levels are monitored throughout. Sedation is given through an intravenous line to keep the patient relaxed and comfortable. Once sedated, the doctor cleans and sterilizes the skin over the abscess site. A local anesthetic is injected to numb the area, which might cause a brief stinging sensation. The skin is then covered with a sterile drape to maintain a clean environment. Next, the doctor uses real-time imaging to locate the abscess exactly. This step is crucial to avoid damaging nearby organs or tissues. Once the abscess is pinpointed, a tiny skin incision is made at the entry point. Through this small opening, a thin, hollow plastic tube called a catheter is carefully inserted. Sometimes, a stiff metal guide called a cannula is used first to help guide the catheter into the abscess cavity. Once in place, the guide is removed, leaving the catheter in position. With the catheter in place, the infected pus and fluid are drained out. A syringe may be attached to collect a sample for lab testing, which helps identify the bacteria causing the infection. The catheter is then connected to an external drainage bag, allowing continuous removal of fluid. The catheter stays in place for several days or until the abscess has fully drained and the infection begins to resolve. The length of time depends on the size of the abscess and how well it responds to treatment. During recovery, patients usually receive antibiotics to fight the infection and pain medications for comfort. The site where the catheter was inserted is checked regularly for signs of infection or other complications. Follow-up imaging scans may be done to confirm that the abscess has healed completely. This minimally invasive approach is preferred because it often avoids the need for more extensive surgery. It has a high success rate, typically between 70 and 90%, and usually leads to shorter hospital stays. However, not all abscesses are suitable for this method. If the abscess has multiple compartments, is located in hard-to-reach areas, or does not respond to drainage, surgery might be necessary. In some cases, especially with deep pelvic abscesses, doctors may use alternative routes for drainage, such as through the rectum or vagina, guided by imaging or endoscopy. Overall, percutaneous abscess drainage is a safe, effective way to control infection caused by diverticulitis. It is performed by specially trained radiologists in a controlled setting, always with the goal of maximizing safety and promoting healing. If you suspect an abscess or have diverticulitis, it is essential to consult with your healthcare provider for personalized advice and treatment options.